Good afternoon. All right, so I know we just came off of lunch and we had two wonderful speakers. Thank you so much for giving such good information and insight. So without further ado, there we go. All right, so we're going to be talking a little bit about nutrition and liver disease. So we also are going to be touching on a little bit of sodium basics, talking a little bit about protein choices, as well as weight management and diabetes. We're also going to be talking a little bit about the MyPlate guidelines and then also some meal and snack ideas. All right, so when I started in transplant 5 years ago, I didn't realize how complex the liver really is and how many different functions and pathways the liver does. Does anyone know or want to guess how many functions the liver does? Oh, I see you signed to me. 500 functions. It's a lot. And so these are a few of the nutrition pathways. So it is responsible for carrying away waste and breaking down fats in the small intestine, thanks to bile. It also produces proteins and cholesterol, as well as converting an excessive glucose into glycogen for storage and regulating blood level of amino acids, and storing iron and clearing out your blood of drugs and bacteria and regulating those blood clotting. So that's why I call it the nutrition powerhouse. So when your liver isn't working properly, many pathways are affected. So how you eat is very impactful with the disease as well. So if you are having liver disease, this is a recommendation for your diet. Following a low sodium diet can be very beneficial. It can help with decreasing swelling. It can also help with that fluid such as ascites and edema. It also helps with getting, with sodium in fluid, it often acts like a magnet in the body. It can also make you hold on to fluid oftentimes. And then also protein, our high protein diet can help prevent any type of malnutrition. It can also aid in increasing muscle mass. It can also help with building muscle mass. So let's see here. And then if you're having a poor appetite, let's see, 4 to 6 small meals is typically recommended throughout the day, or I like to call them the mini meals. But if you have a great appetite, I do recommend just continuing on with the 3 meals and snacks as often as possible. And then also, if you have diabetes, following a diabetic diet is very helpful, along with taking your medications, but it is helpful in the long run even after your transplant if you do get one. Also, protein supplementation, we'll be talking a little bit on that and touching on that. We already had a little advice about the protein supplements and how it can fuel a car. I like that analogy. And then also initiation of resistant exercises and physical activity, which we won't talk too much on, but just a touch. But it is important for liver disease to be doing some type of resistant exercises and maintaining that muscle tone. All right, sodium or salt. It's often found in many different products. It's found in a lot of the processed foods, fast foods, restaurants, preservatives. I'm not super concerned with foods that are oftentimes with naturally present. I'm not concerned about potato that has 3 milligrams of sodium in it, but I'm more concerned about anything with a food label or if you're dining out. So ways to reduce salt or sodium in your diet is oftentimes limiting how you're preparing your meals, like you want to be preparing your meals at home, and then also doing more fresh or frozen vegetables. So avoiding doing like any type of cheese or gravy or sauces that can add a lot of extra salt or sodium to your diet. And then also using more herbs, lemon juice, cooking vinegars are great, onions, peppers, and spices. I don't recommend oftentimes the salt substitutes because those are very high in potassium. Some of my patients, they can easily do that with no problem, but some, they need to not be doing that and doing more of the herbs and spices, and Mrs. Dash is totally fine to do as well. All right, sodium. So this is the general recommendation for sodium. Most Americans consume between 4,000 to 6,000 milligrams of sodium a day. So if you can kind of see on that little table here, 1 teaspoon of table salt is usually about 2,300 milligrams. So 2,000 milligrams a day is generally not very much in the grand scheme of things. So usually that recommendation kind of breaks down into 500 to 600 milligrams for if you're doing 3 meals a day, and if you're doing 4 to 6 mini meals a day, we usually recommend 300 to 500 milligrams at a meal. So some effects, if you are doing a higher sodium diet, usually it's causing that increased swelling, and then also it does increase your blood pressure and increasing your thirst. Also keep in mind, about 75% of sodium in our food is already in there by manufacturers, while 15% of our sodium intake is added at the table or stove. So just keep that in mind. So that's why it's so important to be reading over a nutrition food label. If you're not looking at food labels, I encourage you to. The main thing when you're looking at it from a liver standpoint for sodium, you want to look up here, the serving size, and then you want to look down here at the sodium, that second arrow, and that's what you want to strive for. So this information only relates to that serving size. It does not relate usually to the whole container unless the serving size is the container. So you want to strive for less than 140 milligrams per serving. It's going to be a low sodium product. And then also if you want to use the percentiles right over here, that's going to be less than 5% as well. So protein, we do talk a lot about protein before and after a transplant, but with liver disease, we do recommend oftentimes it needs to be a lean or low-fat protein choice. It does help with building that muscle tissue, and it also helps provide strength for your immune system. As always, the best sources of protein are going to be those that are low in fat. So eating a large amount of fats are usually not recommended because it is bad for our heart health, so we want to try to be very careful with that. So poultry, as you see here, poultry without the skin, and usually most of these protein choices should be baked, grilled, or air fried. Beef and pork, less marbling, and then if you have, like, for an example, a pork chop, just cutting away that excess fat as well. Eggs, usually we don't want you to do too many of the yellow part, which is the cholesterol at it, but the whites are actually where the protein is at. So if you want to add more protein to your eggs, you can just be adding more of the egg whites instead of adding the cholesterol. Low-fat dairy products, so that's going to be more skim or 1%. We shouldn't be doing whole milk past the age of 2. And then also unsalted nuts and low-sodium nut butters. Those are great sources of protein, but you still got to be careful if you're, it's another way to get extra calories in. And then also it's highly recommended from the American Heart Association to do a protein alternative, which is like low sodium beans and peas, but trying to do that for twice a week instead of animal protein. I know we've had a little talk about the protein supplements, but I did want to just touch on that because some of my patients do struggle with appetite. They're not eating very great. They usually need to be doing some sort of protein supplement. Usually that's going to be, I would say, most of them love the Premiers because they're thinner. And then they also like the Premier Clears because they are more juice-like in supplement. They are lower sugar. Most of your protein supplementation is going to be based on your budget and your time. So keep that in mind. If you have time to sit there and fix like a whey protein powder with some milk, that's totally fine to do, but some of my patients don't have that time or flexibility. It is the most cost-effective. Some of them rather just have a drink that's ready-made. So it just depends on those two factors, really. But lots of my patients love that they're a long shelf life, they're versatile, it's very easy to take it on the go. And then also, you want to just make sure you get the biggest bang for your buck. So up there it says, say, 15 to 30 grams. If you're doing more than 30 grams in a sitting, your body can't absorb usually very much of that. So I usually do recommend between 15 and 30 in a protein supplement. If you're doing less than 15, you're better off just doing a cup of milk. So I do recommend trying to make sure you're getting the biggest bang for your buck when it comes to protein supplements. And then some of my patients, I would say, we did a little research project on them a couple years ago just to see how many liver patients were malnourished. And I would say 95% of our patients had some form of malnutrition. And that comes from different reasons. It can come from a loss of appetite, taste changes, feeling full very quickly during meals, having that nausea, that vomiting, and then also being on a low sodium diet isn't always the best. And then also that liver just difficult digesting and absorbing certain nutrients. So this is some ways to kind of prevent or work on either malnutrition or if you're struggling with a poor appetite. And I will also add that it doesn't matter what your weight is. You can be at any weight and still have malnutrition. So just keep that in mind. So these are some goals to work on. So that smaller, more frequent meals. So 4 to 6 mini meals is better than the 3 big ones. Planning ahead and taking advantage of when you do have a better appetite. Adding those protein shakes and powders and bars that we just talked about. Taking advantage when you do have a increased appetite, whether it be a certain day or maybe you just had a procedure that allows you to have a little bit more room in your stomach. That's when you want to try to eat a little bit more. And then some of my patients they like to drink during meals. I sometimes recommend to hold off on drinking their fluids and just wait till after their meal is done. And then also making sure that you are eating that protein first if you're not eating very much, and then focusing on the other items on your plate. All right, moving right along. Intentional healthy weight loss. So we do want slow progressive weight loss if a patient needs to be working on some healthy weight loss. I would say that you don't want to have 10 pounds in a week or 20 pounds in a month. Most of the time when people do that, they often will regain it. And it's usually not healthy weight loss. It's not sustainable. So these are some guidelines. So lose weight slowly. So 1 to 2 pounds a week is usually what's recommended. And then also half your plate should be fruits and vegetables. So we're going to talk a little bit more about the My Plate later. And then also, this is a hard one, but not skipping meals. Eating more consistently is really important for your metabolism. It's really important to prevent any type of overstimulated appetite. So it's really important to eat consistently and not do 1 meal a day. And then also practicing that mindfulness. We do talk a lot about that with our patients, of practicing a mindful check-in of where you're at with your body. And then also, if you dine out frequently, trying to limit that to 2 to 3 times a week. Sweets and treats, they're not part of every meal, every day, unfortunately. So we do want to limit those to 1 to 2 times a week. And then if you have a body, I want to see you moving it. So moving 30 minutes 3 to 5 times a week. That can be difficult for some of our patients. I would suggest if 30 minutes is too difficult, maybe breaking it up into segments of doing 15 minutes twice a day or 10 minutes 3 times a day. So diabetes, and there is a handout I will add in the back if you do want to pick up something. Diabetes, and Teresa's back there waving it. If you would like to pick this up on the way out that goes over diabetes, it's a very individualized diet. It's not a one-size-fits-all. So ideally you want your blood sugars to be between 80 to 130. Half your calories should come from carbohydrates. And then also your A1C needs to be less than 7. We are going to talk a little bit about the My Plate, but just keep in mind you should be having some healthy form of carbohydrates in your diet. So, what is the My Plate? Anybody heard of that or seen that picture? It's almost on every slide I have. So it's really important. We used to have the food pyramid back in the day. I think in 2011, 2010, they came out with My Plate, and it's just an easier form to learn. It's more visually appealing. Half your plate should be some fruits and vegetables, as you see here. And then a fourth of your plate should be some grains, some whole grains. And then a fourth should be that lean or low-fat protein that we talked about. A dairy product can be part of your meals as well. And they are very important just to make sure you're doing a well-rounded to get all your nutrients in. And then with this, I just kind of made some slides on what an ideal healthy day of eating looks like. It can be customizable. You know, you don't have to be doing bananas if you don't like bananas. You can do strawberries. You can do any kind of fruit, really. And it does have it broken down for breakfast. And this is just an example for overnight oats. And just make sure your drink choices are a little bit on the lower calorie. And then this is for lunch, some examples of maybe doing a burrito bowl. That looks kind of similar to what we were doing for lunch today. Having that grilled chicken and those grilled vegetables, and then your iced tea with no sugar. And then for your evening meal, this is just another example, but you can do fish, you can do tilapia. I recommend baked catfish often, or if you want to do salmon, that's fine too. And then also doing some sparkling water is fine as well. And these are some snack choices that I have put together. So it does have popcorn listed here. You can do yogurt, you can do cottage cheese. I do recommend a lot of my patients with liver disease to do some protein added to it. So if they do a low sodium peanut butter with some apples or graham crackers, that's fine too. But just doing some sort of protein added to their snacks. And these are my references. And then if you would like to be working with a dietitian, unfortunately, I can only work with transplant patients that are in workup or after their transplant. But we do have resources at Methodist that you can work with a dietitian in the outpatient counseling section. So you do need a physician's referral. Most of our hepatologists do refer to them, or you can get your primary too. And then we also have the Methodist Weight Management and Wellness Center, and they have dietitians on staff, and they have surgical and non-surgical options to work on weight management. And with that, do we have time for questions? Or do we wait to the end?
Questions? Any questions? But please make sure you pick up the sheet that she's put together. It's really good.
Yeah, it just goes over that My Plate and the what to expect after transplant. Yes?
So I've always heard that eating something before you go to bed, if you're pre-liver,
Mm-hmm.
is very good.
It is, especially for our diabetics, I would say too. It's always good to do a little nighttime snack. So the question was, is it good to do a nighttime snack before you go to bed? It's totally fine to do a nighttime. I do have some people that believe that you need to cut off eating at a certain time. I don't want my patients or anybody really to be snacking all through the night, but I don't mind them having like some graham crackers or peanut butter, especially if they're diabetic, because their blood sugars can drop through the night. And if they're on insulin at night, that can be, their blood sugars can drop as well. But yeah, nighttime snack is completely recommended. Just not a bowl full of ice cream every night. Maybe some yogurt and fruit or something like that. Any other questions?
Grilled is great, right?
What was the question? Grilled? Yeah, grilled is great. You can do grilled, air fried, baked. If you want to saute something in a pan, you can do that as well. Just deep frying, which we do often in the South, we want to try to limit. All right.
Well, thank you.
Thank you.